ALT reflects the function of the hepatocytes themselves. So if there's an issue affecting the liver itself, or some viral infection or medication that affects the liver in particular, it will cause a rise in ALT. These issues include hepatitis, cirrhosis, or simply any liver injury. The range is between 7 and 56. On the other hand, AST indicates the enzymatic function of the liver, but it can also increase in conditions that affect the muscles or the heart, so it's not specific for the liver itself. Most notably, the levels will be very high in cases of alcoholism. ALK-phos, or ALP, indicates the function of the biliary tree. If you have something obstructing the biliary tree, like gallbladder stones or obstruction downward by some tumors or whatever, it will cause a rise in ALP, especially in patients who are having gallbladder stones that slipped through the biliary tract. The range should be between 44 and 150. Gamma GT is similar to ALK-phos. It can also reflect the function of the biliary tree, and if the levels are elevated, it can indicate obstruction of the biliary tree, or it can also indicate excessive alcohol consumption in acute state. Although the levels are lower, it should be less than 48. Bilirubin is a product of hemolysis. The normal life cycle of a blood cell produces a constant level of bilirubin. And once bilirubin goes to the liver, it can be conjugated using different enzymes. In any case, a high levels of total bilirubin can indicate hemolysis, liver problems, or biliary duct obstruction. The patient is expected to have symptoms related to jaundice, like yellowness of the skin, pale urine, and dark stool. They can also have itchiness all over. On the other hand, direct or conjugated bilirubin is a product of the bilirubin that's been through the liver and conjugated. The conjugated bilirubin is almost exclusively excreted through the bile. So if you have something obstructing the biliary tree, it will cause a shooting up of direct bilirubin. And the levels are very low. It should be less than 0.3. Albumin is one of the most important and commonly produced proteins by the liver. Lower levels indicate problems in the liver, like something affecting the liver and preventing it from producing albumin. This is especially the case in cases of chronic malnutrition or some chronic inflammatory conditions. The levels of albumin are very similar to potassium. It should be less than 5 and more than 3.5. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.